Due to the COVID-19 crisis, the frequency, severity, and complexity of humanitarian crises have increased worldwide. In a crisis-prone area like Nepal, the secondary impacts of COVID-19 have been devastating for poor families, especially families with children who have increasingly become more susceptible to stresses and shocks that not only reverse development gains, but also leave them vulnerable to intergenerational transmission of poverty. For instance, in recent times, dietary intake for children has worsened, with fewer of them meeting their energy and micronutrient needs. To combat this crisis, UNICEF, through a cash plus approach, pledged to support the most vulnerable households affected by COVID-19 by delivering assistance in the form of cash, nutrition, hygiene products, and child protection services through the existing social protection system. UNICEF identifies and quantifies children deprivation analysis carefully by sorting indicators such as palikas with available Universal Child Grant, palikas that fall under Nutrition Priority 1, and data from Child and Family Tracker, CFT. In addition, the program area and the most vulnerable households were identified and targeted based on multiple deprivation analysis, combining both chronic, pre-COVID deprivation as well as new, COVID-induced deprivation. Among the pre-existing chronic deprivation, the palikas were identified in Priority 1 based on World Food Programme's Vulnerability Index, with the highest socio-economic needs, people from flood-prone areas, and areas with existing high burdens of malnutrition. Implementation of the Universal Child Cash Grants Programme was expanded based on the Human Poverty Index. The COVID-sensitive criteria were job loss during COVID and those who are struggling to meet food needs. In coordination with the Ministry of Federal Affairs and General Administration, and in collaboration with the 12 palikas that were identified, the Cash Plus support program was proposed in order to provide the most marginalised and at-risk households with income support, which, in addition to cash support, also include hygiene products, as well as psychosocial, health and nutritional counselling and services. In the selected palikas, the program was delivered through Government's Social Security Allowance (SSA) system. Data from this registry was made available to UNICEF by all relevant palikas and was further processed to identify the most vulnerable households. Altogether, 8,902 households were provided with cash, 7,371 of whom were from Dalit households with children under 5, and 1,531 of whom were households with disabled individuals. All in all, a total of 122,342 households in the 12 palikas were supported through this Cash Plus support program.
त्यसले धेरै सहायता गरे बच्चाहरूलाई नपुगाउन सकेको चीज पुगाए उसको स्कुलमा भर्ना गरे अनि खानपानको कमी परेको थियो कोरोना कालमा त्यो अलिकति धेरै नभए नि अलिकति मद्दत भयो
अब पैसा पाइयो बच्चालाई पढाउनी बैंकमा राख्दै नास्ता पानी खानलाई बच्चाहरुको नाम लेखायम ड्रेस किन्यो नास्ता पानी अरूको पैसा बैंकमा राख्दै
बच्चालाई 10,000 आछ गरे भनेपछि हामीले गएर त्यो पैसा लिएर आयौं अनि मेरो पानी खाने धारा थिएन मैले अनि त्यो अलिअलि काटिम तरकारी लगाएर खाने हुन्छ धारा भएपछि भनेर अनि मैले वहीबाट धारा लिएर आए अनि बनाइहाले अनि अहिले ठिकै छ सुविधा छ अब आफ्नो घरमा धारा छ अनि पानी खान पाइएछ कपडा धुनलाई सजिलो छ
खानपानमा अब यो भने अब खानपान भनेको घरको रासनहरुको कमी परेको थियो नि त त्यतिखेर खाने कुराहरुमा अब त्यही दाल चावल बच्चाको पोषणमा माछा मासु अण्डा त्यही कुराहरु दियौं लुगा कपडाहरु बच्चालाई हामी धेरै जसो लुगा कपडाहरु किन्न पनि सक्दैनन् कान्नेर त्यो किन्नियो राम्रो लागिरहेछ धेरै अब सहायता पाएर धेरै उ भएछ एउटै कमाउने मान्छे हुन्छन्, एउटै कमाउने मान्छे भएपछि त्यति साह्रै हामी पुगाउन पनि सक्दैनौँ।
सामाजिक सुरक्षा भत्ता अन्तर्गत 5 वर्ष मुनिका दलित बालबालिकाहरूलाई बाल पोषण भत्ता भनेर नेपाल सरकारको नीति अनुसारले उपलब्ध गराइरहेका थियौँ, जसमा एउटा युनिसेफ प्रोग्रामदेखि क्यास सपोर्टको प्रोग्राम आयो, जसले गर्दा दलित बालबालिकाहरूलाई केही राहत यो कोभिडको टाइममा उहाँहरूलाई जीविकोपार्जनमा धेरै सहजता ल्याएको छ यो प्रोग्रामले। यो लालझाडी गाउँपालिकाको 79वटा घरधुरीलाई क्यास सपोर्ट प्रोग्राममा सपोर्ट गर्यो, जसले गर्दा धेरै राहत चाहिँ यो प्रोग्रामले दिएको छ। उहाँहरूको साथ सपोर्ट र हाम्रो समन्वयले गर्दा यो प्रोग्राम निकै नै प्रभावकारी भएको छ उहाँहरूमा, जसले गर्दा लाभग्राहीहरू एकदम खुसी नै भएका छन्।